The Biomarkers of Aging Consortium 2025 takes place between the 20th and 21st of October at the Joseph B. Martin Conference Center at Harvard Medical School in Boston. Now, this really is one of the most standout, important event conferences in our field. It brings together world-leading academics, clinicians, and industry experts to advance the development and the validation of aging biomarkers, which of course are driving innovation through open science and global collaboration. Today, we'll explore how standardized biomarkers are shaping the future of longevity interventions and, of course, translational neuroscience. And I'm really keen to jump right in. So I'm joined today by Andrea Cipriano and Jesse Paganik. Hi, guys. Thanks for joining us.
Great.
Okay. So, Jesse, let's talk a little bit about the conference. Obviously, you're in your third year now, right? Is that correct?
That's right.
All right, great. So third year, and of course, we know the role that you're playing in the field, but I guess really interested to know what we're going to see differently at this year and how you're moving the needle forward.
Yeah. So, the conference in many ways, I would say, mirrors the work that we're doing throughout the rest of the year. It gives us an opportunity to show off what we've accomplished and also to define the path ahead. So in 2023, you may remember we had the one-day conference, which was our first kickoff event. We expanded that last year and moved to the Boston location. So it's now a two-day conference, and that worked out really well. We had, wonderful attendance, many different US states and countries represented last year, and a really wonderful group of people. So we decided to stick this year to the Boston location and to the two-day format. And in line with the work that we've been doing, I would say that we're trying to move closer and closer to the clinic with biomarkers of aging. And so part of that, as I think we'll get into later, is working with other groups that have the same goal. And part of it is trying to bring in the clinicians that will be the users of biomarkers of aging in the clinic. And so I think that will be one of the most exciting things for me about this year's conference is the increased emphasis on clinical integration of biomarkers.
That's really interesting. So, of course, there's some of us in the field that are just waiting for those standardized markers at some point, whatever form they're going to take. But you feel that the clinicians have an intrinsic role to you in developing the work of the consortium?
Yeah, of course. They're going to be the ones who are using these biomarkers in the clinic. So, of course, we need to have them on our side, so to speak. But it's also important, of course, to get their perspective because they think in a very different way than we, speaking as two people who are primarily in the research world and on the development side of biomarkers. They think in a very different way. Their priorities are different. The way that they need to explain the biomarkers and the results to patients are very different than the way we think about how they're explained to a research audience. So it's really essential to have the perspective in addition to having them as the end users.
Yeah, and I guess the questions at the back of my mind, of course, there are different people of interest to the consensus that will come out of this, right? Because at the end of the day, a lot of those clinicians are going to be working with the therapeutics that are available today, right? But of course, we want to be having those biomarkers and maybe surrogate endpoints for the development work that's going on in the labs and obviously in clinical stages at this stage. So there's a big crossover there, right? So how are you addressing that with those two diverse groups together?
Well, by bringing them together primarily, at least in terms of the conference. And, in my mind, I see these parallel tracks, or I hope, I guess I should say, to see these parallel tracks coming together at some point where you have the people that are very focused on developing and validating the therapeutics. You have our world, which is really focused more on the biomarkers, which will be essential to, proving that the therapeutics work, identifying individuals that are going to benefit from the therapeutics, monitoring their progress, et cetera. And the research world, the real essential discovery, the things that we're not even thinking about right now. And then also in parallel, the clinical world, where you have healthy longevity medicine really emerging as a discipline. And if I can link that to a small plug for the conference, our keynote speaker this year is Andrea Meyer, who is one of the key people involved in this new Healthy Longevity Medicine Society, which is a group of very serious clinicians who are interested in bringing biomarkers of aging into their clinical practice. So that directly supports our overarching goal with the consortium. And that's an example of bringing these communities together and doing outreach to these other groups that share our goals.
Great. And of course, Andrea, I saw you just present at ARDD. Of course, it looks like you're moving in a very positive direction. There's we're going to see some results at this year's conference of the work that's been done before. Question for you, though, is, of course, how close are we to consensus and definition of standardized biomarkers, right? I mean, are we kind of there already? It's just a case of validation, or have we still got more work to do before we can get there?
Yeah, that's a great question. So one of the mission of the consortium is actually reaching consensus, and I think it's the motivation that brought us actually to develop the consortium from the beginning. Because again, aging, as I also mentioned during the conference, the biggest issue is the definition of the process itself. So develop a biomarker reaching consensus on something that is still difficult to define is extremely challenging. So our goal is, first of all, come up with definition of the process that are actually current so that people can then start working. So regarding the consensus, what we are trying to do is also trying to decipher the different dimension of aging, because every dimension has its own dynamics. Every organ has a different aging pace. The immune system, for example, has a huge system that is also embedded in our body. So the goal is, again, yes, reach a consensus, but this consensus might lead also to development of different types of biomarker based on the biological process within the aging field that we want to study. And I think this is an essential point, and also our consortium is actually trying to expand from a biomarker of aging to biomarker of immune aging, brain aging, just to oversimplify the concept. But I think this is extremely essential, because we should start considering aging like splitters. There is Steve that was they said that there are the splitters. So basically dissecting the biomarkers is extremely important. And one of the biggest issues that we have today is that all the epigenetic clocks that we have are not biologically informed. So are like black boxes. So reaching a consensus on something that doesn't have a biological explanation is extremely challenging. And that's why we're also trying to reach this consensus, trying to develop specific biomarkers that are actually biologically informed.
Yeah, and I guess when you presented at ARDD, I was picking up the fact that obviously there's the Harvard-Stanford protocols, which was very interesting to see. Of course, you've got your recruitment criteria, you've got tissue collection, you've got the biomarker collection, but you're also doing functional tests. I mean, I was really pleased to see grip strength on there, right, as a kind of as an example. So you've already done some work, right? And I guess, are you going to be reporting out on that work as a kind of progress of where you've got to so far? Because I'm sure some people are going to pull it apart, but at least you've got something to show, right?
Absolutely, yeah. Let me take just a quick step back also to highlight the importance of this study, because I didn't mention, but also one of the reasons, because the field is not developing stronger and stronger biomarker, is that despite there is a huge technological and computational improvement, AI is basically doing magnificent things now. The biggest problem is that if you don't give to this program good food, so good data, it's going to be difficult. So what we need in the field is actually longitudinal studies, meaning that we need to profile people every year and to combine, as you highlighted, functional with molecular, because at the end of the day, as you mentioned, a molecular is a proxy of aging, and aging is a functional phenotype. So what we are trying to do is actually to develop this longitudinal study. And last year we ran the pilot, which was for us an exercise, a training to understand actually how much it takes in terms of IRB approval or people recruitment. We also circulating the questionnaire with all the longevity clinicians. Andrea Meyer was a great contributor. So also to try to understand how we can take from participant functional information. We ran the walk-in test, the balance test. So at this conference, we're basically showing the results that we basically have developed. But an important thing that I also highlighted in the ARDD is that we need support, because these studies are long studies. They're expensive studies, because you have to biobank the sample, you have to collect the sample, you have to run. So now we are trying to scale it up. We are trying actually to go from 100. The goal was actually going to 300 participants, developing like sister studies. So during the conference, we will basically show a pilot example of how a longitudinal study can be run, the data that can be collected, the functional data and the molecular data, with the goal of actually push the field and the community to actually develop more of this study on healthy people. That is essential, because if we want to measure aging, we don't want a population that has chronic like the disease or chronic illness, because this would confound the study. And it's also the reason why most of the studies available are not very useful, because they're measuring something else rather than aging.
So, that's great. Yeah. So you're going to be, so the audience are going to get some report outs, which is great. What other types of new initiatives are you going to be announcing at the conference? Because I guess, there's a lot of work going on. So is there anything new coming out?
Yeah, so I can start. Yeah, I can start maybe with the challenge series. So that part of that was reported last year. And we designed that in 3 different phases. So the first phase was to predict chronological age. And the results of that were actually really interesting, because the winners beat the performance of the best, existing published biomarker of chronological age.
Wow, that's fascinating.
So that already was a huge milestone. And we also had a competition to predict time to death. And, that again yielded some very interesting biomarkers, and also some really inspiring people won those, which won the prizes, which are, I think, effectively expand the field a bit. So the third phase, which we'll talk about a little bit at the conference this year, and then probably launch later this year or beginning of next year, is our most difficult challenge. Most difficult in terms of the challenge, and most difficult, ironically, in terms of the design, because the judgment criteria are very challenging to design. Because the third part of the competition is focused on health span or multimorbidity, and of course, this is something that everybody cares very deeply about in the field, for good reason. And so the question, that underlies the third phase of the competition is, can you predict the time to the appearance of the diseases of aging? So that will be, I think, a very interesting phase of the competition. It will be, I think, the longest phase of the competition, because we're going to need to give people time to be able to do it. And as we did with the first 2 phases of the challenge series, we will release new molecular data. And just to remind people, the sort of ulterior motive, so to speak, of the challenge series was to develop this gold standard benchmarking data set, which we've been building slowly over time. We launched it with epigenetic data. In phase 2, the mortality challenge, we added proteomic data. And in this phase, we'll be adding metabolomic data, which is the generation of which is being finished as we speak. So at the end of all of this, we hope to be able to give the field this gold standard data set with which they can benchmark and validate any new biomarker that they may develop.
Yeah, and I guess, Jesse, just a sort of perhaps a stupid question, but how are you validating that? Are you using historic biobank data in a sort of blinded way, so that people are given a starting point and you know what the endpoint is, but they've got to predict it from the information they've got?
Exactly. So that's how we've done it. That's how we've done it so far. So the data come from a biobank. The samples that we selected were selected in such a way that we have a significant population of people who have died since donating their sample. That allows us to do the mortality prediction. And because it includes older individuals, because it includes individuals who have passed away, it is also highly representative for the chronic diseases of aging. So that's what's going to enable phase 3. But yeah, very basically speaking, the idea is that we release the molecular data at the beginning of the competition with none of the labels, just random identifiers. And in the first phase, we said, okay, tell us how old these people are based on these epigenetic profiles. In the second phase, we said, identify the individuals who are deceased and tell us the time to death based on when the sample was taken. And it will be something similar, of course, with nuances and complications for the multimorbidity competition, which we'll get into at the conference. But we will release the molecular profiles, some of which they have already, the epigenetic and the proteomic profiles. We'll also release the metabolomic profiles, and we will say predict the time to the chronic diseases of aging.
Great. Well, that's really amazing to hear. So maybe let's talk a little bit about XPRIZE, because I saw that obviously you're partnering with XPRIZE. That's a competition that's got a lot of people's attention. So how are you guys collaborating with them?
Absolutely, yeah. So I want to link with what Jesse said, which I think is very important, that defining multimorbidity and judging was actually one of the most challenging parts for us. And we share this challenge with XPRIZE because, as you know, they need actually to evaluate a team of people, and the price is significantly higher than the price that we are offering. So it's a very important competition. So with Jamie Justice, we actually talked, and she was like, we need to develop a kind of guidance to actually evaluating immune aging biomarker. And again, immune aging is playing a pivotal role within the aging field because it seems to be one of the biggest drivers, I would say, of the aging process. So what we did was actually to build out a team of people that are expert in the immune aging field. And we tried, first of all, we did a lot of research about what was the state of the art of available immune aging biomarker. And we realized that it was confusing, again, the definition itself. Chronic inflammation, inflammaging. So the first thing that we did by bringing together the expert in the field was to define immune resilience, immune aging. And after that, we established the criteria of a good immune aging biomarker. So we said, okay, let's pretend that we can identify the best immune aging biomarker. Which are the criteria that this biomarker should have? And this was another important part of the collaboration with the XPRIZE that we did. And the final is, okay, these are the gold standard. What's the state of the art? So what do you have available now? Which are the biomarkers that we have now? And what are the ones that apparently can be the most predictive, so that can be used for the XPRIZE competition as a case study, but actually from the field to actually measure and evaluate immune aging. And the third part of the collaboration and of the manuscript is okay, let's push the boundaries. What do we need in the future in order to have a biomarker that actually can be used for clinical trials? Because I want to highlight that this paper is biomarker that can be used for clinical trials, geroprotectors, for evaluating in general, immune aging in clinical trials. And so we did it by having 2 workshops. So we discussed among the experts, we collected their input, they worked on the manuscript. So it was a very dynamic and iterative process with 2 workshops. And now we're basically collecting all the findings together. And the goal is to present during the second day of our conference in the immune aging session. We're going to have a dedicated section to the immune aging that also XPRIZE is sponsoring. And we will basically discuss what I just told you, so which are the criteria, what is available, and also the frontiers in order to push the field. And again, it's part of the mission to have consensus and guidance so people can actually direct in putting together effort to actually go in a specific direction, which is in this case develop reliable immune aging biomarkers.
Okay, great. So are you working just on the immunity aspect of XPRIZE, or are you working with cognition and the mobility and muscle piece as well?
Immune. Yeah.
Okay,
this collaboration was centered. Jamie is also developing other biomarker with other experts, but the collaboration we did was specific, centered in the immune system.
Okay, great. Well, that's really.
But hopefully more to come, because as you know, they're collecting samples in such a way that I think it's going to be one of the first times we're going to have really robust biospecimens available to test the response properties of aging biomarkers, which is a really underexplored area for us.
Yeah, and of course, Jesse, we fully know that this is really valuable work to the overall field. So who's going to be at the conference? I mean, I guess we know some of the speakers from the website, but what's the sort of mix of attendees that you get there?
Well, it's as I said last year, we were really pleasantly surprised to see that we had dozens of countries represented. I think nearly half, if not more, of the states in the U.S. So really, we had people from far and wide. I mean, as far as a group from Japan who is actually attending again this year. And they range from basic researchers to clinicians to biotech people. They range from people who are really steeped in the field, really focused on aging biomarkers, people who are in the aging field but maybe not particularly or primarily focused on biomarkers. To borrow someone else who I can't remember his phrase, you have also the aging curious community, I think, who shows up. And I also just want to mention that one thing we haven't touched on so far, we're actually having sort of a bonus event this year, the day after the main conference, which was a small half-day symposium. This was spearheaded by Madi Mokri, and this is going to be focused on brain aging and biomarkers of brain aging. So I think we're going to get a lot of neuroscience and cognitive people this year as well, which will be another unique community. But it's really wonderful to have so many different people join us every year.
Yeah, well, I mean, obviously, you've really set the wheels in motion now, third year in. So, how do people find out more about the conference?
Well, they can visit the website agingconsortium.org and view the lineup, get the tickets. They can reach out to, I think, really any of us on the team, me or Andrea or anybody. We're of course always happy to talk about this. And am I missing anything, Andrea?
I would just, in addition to the great speaker, we also have 100 posters. And I think the value of the quality of the poster last year, we were really, really impressed. We have evaluated all of them. They are amazing. They're going to be like flash talks, because I think also sponsoring science for people that are like younger investigators, I think is extremely important, and it's like part of the conference, one of the conference mission. So we're going to be also heavy in like poster presentation also these years.
Yeah, that's great. Well, we're big fans, guys. So thanks so much for all your hard work. So Andrea and Jesse, thanks so much for joining us today.
Thank you for the opportunity. Bye, Phil. See you at the conference.